Hello viewers, welcome to my channel. My name is Florence Nalunkuma from Kampala, Uganda. Today I've come here to explain to you about dental diseases. Specifically, we are going to talk about dental caries, or what they call holes in the teeth in the local language. So this picture here shows us the picture of a tooth, a molar specifically. The last tooth, the second last and the third last, it's a molar, it is here. It has two roots and a crown. The crown is the white part you see in the mouth is the crown. Then the lower parts, which are roots, are down below. So before we go ahead, please subscribe to my channel, click the like button, and share to your friends, and also comment in the section below. Now we have a structure here. I'm going to show you the parts of the tooth, and I show you how the caries attack the teeth. So this first part here, this is the enamel, this one. This is the enamel. This is the dentin, the yellow one. Then this is the pulp cavity. So when you eat refined sugars, especially cakes, sweets, biscuits, bread, you frequent them, and when you eat them and you don't brush immediately, so they form around the crown of the tooth up. They form acids. Some bacteria feed on that sugar and it forms acids. That acid starts burning the tooth, starts burning this upper part. As we know, the enamel is the hardest part on a human body. So the acid attacks the enamel here. It creates a very small hole because the enamel is hard. So when a small hole forms here, as you eat food, food is accumulated there, it decomposes and it produces more harmful bacteria. So as we see here in the second picture here, the cavity has started growing. It grows and penetrates into the dentin. When it reaches the dentin, you start feeling some sensitivity. When you take some cold water from the fridge, you feel it is sensitive, but for a short time. You take acidic foods like oranges, pineapples, you feel there is some sharp sensitivity in the tooth. So we are at this stage when it has reached the dentin. So the treatment here, you come to the dentist clinic, we put the cement, what we call permanent cement. Here in the first picture, the cavity was in the enamel. You don't feel any pain because the enamel doesn't have sensory nerves. The enamel doesn't have any sensory nerves, so you don't feel any pain, you don't feel anything. When it reaches here, you start feeling some slight sensitivity because the dentin is near the pulp cavity, which has the sensory nerves. Now here, in the third picture, here the cavity, we can see the cavity has grown. The cavity has grown, it is approaching the pulp cavity. So it has crossed via the dentin, it is almost reaching the pulp cavity. Here, the signs like and symptoms, you take something cold, even lukewarm water, you feel the tooth reacts. Anything you take, it reacts. Taking something hot, it reacts. And the pain can last longer, more than 10 minutes here. So you start taking painkillers. Painkillers, when you take painkillers, the pain subsides. Here, it is at this stage. Now here in the third picture, before I forget, here, when you come to the clinic, we put for you what we call a temporary cement, and we give you some antibiotics. You take after 2 months, the pain it disappears, then you come and we put permanent cement. Here in the third picture, here the pain, the cavity has reached the pulp. So here the pulp is inflamed. The pulp has blood vessels and some nerves. So it becomes inflamed, it swells, so you start feeling the pain, the pressure inside the tooth. That's why some people feel pain at night. They wake up in the night, they cry, the pain is too much. They take painkiller, the pain doesn't subside. So this is where it has reached. This is the cause. So when you come to the clinic, what we do, we have two options. We either remove the tooth or we do what we call root canal treatment. Root canal treatment, we have some small metals which are like, they are called files. We put them here inside. We first give you anesthesia to take away the pain. We put them inside here. We remove this nerve. We disconnect it from the here, from the level down here. We disconnect it from the apex of the root. So we clean all these canals properly. After cleaning, we cover with the temporary cement and we give you medication. Then after 2 weeks you come back, we clean again, still to remove any remaining nerve which is there. Still we cover temporary cement, we give you antibiotics. The third time we complete the treatment. There is something we put here called the gutta patcha here to replace the lost nerve. We seal it here, then here up we put permanent cement. There you are done. Your tooth is okay, it can function again. But the only difference between this tooth and the normal one, this one cannot sense. The sensation is lost because the nerve was removed, but it can eat food, it can keep the structure of the face, it can keep the jaws strong, but when it comes to sensing, it cannot sense. That is the only difference. The normal one can sense because it has a nerve, but this one cannot sense. But it's better than removing your tooth, because the moment you remove, that tooth is gone. It is gone, it will never come back, and we know the disadvantages of extraction. Once the tooth is lost, it will never come back. So it affects the neighboring teeth. They start moving towards that space. The upper tooth, if the tooth they removed was down, the upper one starts growing longer than the neighborhoods, and usually the upper one develops a cavity because it is no longer in alignment with the neighbors. So removing teeth really it is not good. I will encourage people, try as much as possible to save your teeth, because if we lose your tooth, I know we can put artificial teeth, but artificial ones cannot function as the natural one, the normal one. So we advise minimize on the extraction processes. If possible, you can save your teeth early. Number one, you can save by reducing on the sugar contents, especially refined sugars. Reduce on them, the cakes, the bread, the chocolates, minimize them. Or in case you cannot avoid, immediate after eating, brush your teeth. Secondly, you visit the dentist regularly. The moment you visit the dentist, you can identify these cavities. The dentist can identify. For you are with a cavity, but you don't know that it is there because it's not paining. But a dentist can identify it early, then they can put for you the cement and save it. And the proper brushing, you keep your mouth clean, you visit the dentist, you take care of your teeth, because permanent teeth, once it is lost, it will never come back. So that is our lesson today. Thank you for watching. Please don't forget to subscribe, comment below, and like the page. See you soon, my viewers.